What foods can trigger cluster headaches? Have you ever wondered what foods might be causing those intense, one-sided headaches? Cluster headaches can be incredibly painful, often centered around the eye. While the exact cause of cluster headaches isn't entirely clear, certain foods have been found to trigger them for some individuals. One of the most commonly reported triggers is alcohol, especially red wine and beer. Even small amounts can provoke an attack during a cluster period. If you are prone to cluster headaches, it might be wise to limit your alcohol intake. Another group of foods to watch out for is aged cheeses. Cheeses like blue cheese, cheddar, and Swiss contain high levels of tyramine. This naturally occurring compound can trigger headaches in some people, so it's worth being cautious if you enjoy these cheeses. Processed meats are also on the list. Foods like bacon, sausage, and deli meats often have nitrates and nitrites as preservatives. These substances have been linked to triggering headaches, so consider checking labels if you consume these products. Caffeine can be a tricky one. While it can help relieving headaches for some, excessive caffeine or withdrawal from it may provoke cluster headaches in others. If you notice a pattern, adjusting your caffeine intake could be beneficial. Monosodium glutamate, commonly known as MSG, is another potential trigger. This flavor enhancer is often found in processed foods and Asian cuisine. Some sensitive individuals report headaches after consuming foods with MSG. Chocolate is also worth mentioning. It contains both caffeine and beta-phenylethylamine, which may contribute to headache onset for some people. If you find that chocolate seems to correlate with your headaches, it might be best to limit it. Certain fruits, particularly citrus fruits and bananas, have been reported as triggers by some individuals. This may be due to their tyramine content, so if you notice these fruits seem to coincide with your headaches, consider reducing their intake. It's important to remember that triggers can vary widely between individuals. Not everyone with cluster headaches will be sensitive to these foods. Keeping a detailed headache diary can help you track your food intake and headache occurrences. This can be a useful tool in identifying your personal triggers. Avoiding known dietary triggers during active cluster periods may help reduce the frequency or severity of attacks. However, dietary management is just one aspect of treating cluster headaches. Consulting healthcare professionals for comprehensive care and appropriate medical therapies is essential. In summary, alcohol, aged cheeses, processed meats with nitrates, caffeine, MSG, chocolate, and certain fruits are commonly reported food triggers for cluster headaches. However, individual sensitivities can vary greatly. Seeking professional guidance can help you manage your symptoms effectively.